Hi everyone, my name is Sin Ward and welcome to my field capstone presentation. My internship this semester was done at Jasper House. Jasper House is a residential facility which is part of AIDS Alabama. Jasper House is for people that are living with HIV who also have a serious mental illness diagnosis. At Jasper House, I created treatment plans and goals for our clients. I assessed clients and measured their progress towards achieving their goals. I provided case management services one-on-one with clients under supervision, of course. I created and implemented interventions for clients. And I worked with our clients in a group setting and one-on-one to help them understand their diagnoses, their symptoms, their medications, and the side effects of those medications. And also, we taught them appropriate coping skills to promote their independent living and their social functioning when out in the community. So, my first competency that I picked was engage diversity and difference in practice. For this competency, I attended diversity training. It was very interesting. Lots of multicultural people were there, lots of people from different races. We talked about the subject of race the whole time, openly and honestly. It was a huge learning experience. We talked about reflecting on our biases and preconceived notions about other people and how race is a construct. So that was really, really nice to see and to be a part of. Second, for this competency, I researched the cultural implications for the target population of AIDS Alabama. The target population for AIDS Alabama is people living with HIV at risk for contracting HIV. And when I was researching that population, I learned that people of color actually make up the largest percentage of people who are living with and at risk for HIV infection, particularly African American people. Currently, Black women are most at risk for HIV infection. Wow, I would have never thought that, but how terrible, and definitely something we need to advocate against and educate for prevention, surely. Mental illness, substance abuse, and homelessness are closely intertwined with HIV. These comorbidities are significantly higher in communities of color. Also, when it comes to Black culture specifically at my agency, all of our clients there are African American, except for one. And the majority of the staff is African American as well. So it was a very nice and different cultural experience for me. I loved it. And I learned that, due to stigma and their culture specifically, that many queer Black people are ashamed and they don't claim their queer identity publicly. And we actually have a client who, actually a couple of clients that have internalized that shame, and it has led them to, be resentful and even hateful at times towards people who are out or feel like they can live as their true selves, like trans people or just really out gay people. So my second competency that I chose is evaluate practice with individuals, families, groups, organizations, and communities. For this competency, I reviewed client treatment plans to assess their progress toward their goals that they were making. And I utilized treatment plan reviews to assess effectiveness of interventions. During this process, I learned a lot about how services are customized to fulfill client needs. I learned how interventions are crafted and tailored specifically to assist clients in reaching their goals. And, this taught me a lot about the dignity and the worth of the person. And it taught me a lot about how, as social workers, it is important for us to let our clients lead our practice. You know, I know we do research informed practice, but also it should be client informed as well. If it's not specifically for our client, then it's not going to work for them. And the best way to come to the root of how to truly help your client is to really get to know them, get to know their background, get to know about their environment, their upbringing, their current life, the things that they've been through, any mental illnesses or mental health issues, personality disorders they may have, cognitive disorders, you just the whole person experience of social work is really, really important, and it was really emphasized when I was learning about this competency. And I learned that, even though you might write a treatment plan and some goals, and you know what's in that treatment plan, and you know what the goals are because you wrote them, that it never hurts to continuously go back to that and read, especially when you're finding issues with the efficacy of your interventions. It's really important and really helpful to go back and utilize that treatment plan and those goals as a tool to kind of redirect yourself and your idea for your services and your interventions, and to maybe get some new ideas. So, in conclusion, I've learned more about the disparities and social determinants of health within the HIV community and communities of color specifically. I have also learned a lot about stigma and both perceived and actual barriers to care. I never really thought about perceived barriers to care, but that is a thing, such as if you contract HIV and you don't have a car and you need a ride to your doctor's appointment, for your HIV, but you're afraid to ask anyone because you don't want them to know what you're going for. So that's a perceived barrier to care. And so that's a really interesting thing that I've learned throughout this experience. But I've learned about the importance of a treatment plan and its goals, and the importance of continuously reviewing treatment plans and goals, and editing your interventions so that they continue to be effective for your clients. Finally, I've learned a lot about the importance of education about HIV prevention, PrEP, things like that, and that advocacy is very important for the HIV community, and especially communities of color that experience all of these disparities, being more at risk for HIV and much, much more. So, in conclusion, my acknowledgments down in the corner. I would like to thank Simone James and Chasen Baker. They were the best supervisors I could have ever had. They taught me so much. It was an invaluable experience. I would like to thank Heather Rockman. She is the main coordinator of AIDS Alabama. She interviewed me. She gave me, my spot there, and I thank her for that. And I would like to thank future Dr. Melton, Miss Claire Linker, and Dr. Hitchcock, of course, the queen of social work. Thank you, guys.